Our webinar for today is entitled The Front and Back End of Innovation. It's part of our series of Healthcare Innovation Trends from the Trenches, and I want to thank you for joining us. We have about an hour together, and what I've put together is a way of helping people in healthcare, and some out of them, some of our own clients, begin to understand this whole idea of innovation in new ways. So thank you for joining me. I'm Andrea Simon. I'm President and CEO of Simon Associates Management Consultants. I'm a corporate anthropologist and a blue ocean strategist and an innovation games facilitator and a culture change specialist. I list those there because we're aggregators. We try and bring the best tools to use for our clients in helping them change. This webinar series came about because we were working in the field with others like ourselves, both clients and consultants, and we were seeing things happening that we wanted to bring to light in ways that people could begin to test them and use them before they actually had to know whether they were right or wrong. Best practices in changing times are actually very difficult to find out. Chris Barlow gave our first talk on physician services. And we're working with many clients that have bought physician practices only to discover they weren't quite sure what to do with them. Diane Auger gave a marvelous talk about branding and rebranding for changing times. How do you keep the essence of a healthcare institution's brand and yet still adapt it to meet new occasions? And Linda McCracken last month did a marvelous job talking about big data and how data is teaching us all sorts of information and insights that we can then apply to our own institutions to see how we can innovate for them. So mine today is about the front end of innovation. How can you see, feel, and think in new ways? And I really want you to hear me say see, feel, and think many times today, because the way the brain really works is it has to see it and then feel it before it then logically or rationally affirms it and does something with it. So innovation is in many ways about seeing differently. And the back end of innovation, there was a wonderful conference in December on the West Coast about how do we do the back end of innovation. How do you can turn abundant ideas into effective innovations that actually keep working. And the third point is I would like to talk briefly about how to develop a culture of innovation. I just returned from Mexico working with a client there who really wants to take its old, staid institution and make it an innovative one. And yet many of the folks there don't know what the word actually means, so it's very interesting. And then I tie it all together with my 5 steps that sort of summarize this and give you a simple process to begin to follow as you think about your own organization and how to bring innovation to life there. So let me begin. First, think about it. Ideas are very much like rabbits. You get a couple, learn to handle them, and pretty soon you have a dozen. And while I love John Steinbeck, I love the metaphor of thinking about how can you begin to build this in a very soft and very attractive way. I do a lot of workshops. I have 40 for this year, and I had 50 last year. I often open them by asking CEOs, is your organization focused on innovation? And I'll tell you, everyone in the group, 15 or 20 or 30 of them, all raise their hands. It's almost sacrilegious not to be. And then I ask them to tell me something they're doing that's innovative, and I must say, they typically say, not much. And often it's because I'm not quite sure what it means to do innovation. Clearly in the US, it's not for a lack of spending. I was sort of startled by the scope of the healthcare R&D, which is about $53 billion in 2013. The only one that's bigger is defense R&D. And private sector spending on healthcare R&D runs into the tens of billions as well. So it's not that we don't have money. Unfortunately, too many of the efforts simply don't work. Despite the enormous investment, the magnitude of opportunity for people to do good and do well, too many efforts fail, and there's lots of billions of dollars lost along the way. The 3 that I picked up to sort of highlight this, first I joined healthcare at the beginning of the managed care revolution. And I thought it was really, really a fascinating history as you watch the disastrous outcome of managed care that went back to fee-for-service before you could shake a stick at it. Then there's all the biotech ventures. About $40 billion has been lost by investors to biotech ventures. And then you sort of wonder how and why. I've had a number of pharmaceutical clients, and the risks are far greater than you can imagine. And then there's a collapse of numerous businesses aimed at bringing economies of scale to fragmented physician practices. And having worked with so many of them, it's most tragic to watch. The need is enormous. The ability to execute is difficult. So if we're going to think about this, the times are rapidly changing. In change work, we often tell people if you want to change, have a crisis or create one. In some ways, the healthcare revolution today is that crisis. Without it, it was much more difficult. Now we've got lots of folks who don't quite know what to do with it. So the changes are coming fast. The urging that we can only tell you is that if you lead it, you have a far better chance of making it work for you. If you're going to follow, it's going to be a long time before we know what works where, and the old idea of best practices may never come back again. So innovation is going to be critically important. Some of the terms that we use is we often like to think about turning the undesirable to desirable. If we flip everything on its head, reverse everything, we can open the brain up to see things in new ways, which is my second point. Somehow we have to see, feel, and think in new ways. I'm going to talk a good deal about how to do that today. Then I need a process, because the brain is wonderful. You give it a lot of ideas and it is frustrated, it rejects them. So somehow we have to convert what we see and feel to do things, and then do them in new ways, not simply go back to the old habits that we have. And our culture often is both strong and weak. Darwin and neo-Darwinism is under a lot of review lately, but basically what he said was that it isn't the strongest or the smartest that thrive, it's the most adaptive. And during changing times, two things we should be aware of. We need a lot of mutation going on inside of our organization. Think of it as a lot of DNA or genetic mutation going on, and a lot of selection going on in the marketplace to see who adapts the best and thrives. The problem is we hate change. The tendency is for us to see things as you are. So the brain doesn't see things as they are, we see things as we are. By the time we're about 30, we have a perceptual map in our mind that then sorts reality to affirm what we perceive. And so there really isn't a reality. My second quote is by Marcel Proust, which I love. The real voyage of discovery consists not in seeking new landscapes, but in having new eyes. And that's, in fact, exactly the journey that we're on. The problem is that we know what we know. We really know how to run a hospital, put heads in beds, or take care of an office, and we know that we work from 9 to 12 and 1 to 5, and that's when we're available. Those are the things we know. What we don't know is something perhaps like how to fly a plane or a drone or speak Japanese. Then there's everything else that we don't know that we really don't know. And that's where all the opportunities are. It's what both the brain and culture fight. Part of this is because the brain really hates to change. It isn't personal, but that prefrontal cortex that gets involved when you're learning something new requires energy. And the brain uses about 25% of the body's energy. And when it has to learn something new, even a game of golf, as I've learned, it's very painful. Because we really have to work hard to get the brain to accept it, to internalize it. And often, that's because the power of habits. While we love to think that we're full of free will, I love the little graffiti, after you make your habits make you. That's in fact the case. So we're really products of well-honed habits. And then there's the comfort of the herd. Birds of a feather flock together. This is one of my favorite visuals, because in fact we would certainly and more likely please each other doing the wrong things, and then stand out alone and try to change them. Most of our cultures are really about obedience to the crowd. Remember, we're primates and we live in herds, and we go together with others like ourselves. So in order to change in changing times and adapt to the things that are coming, we have to fool the mind. So whether you call it change or innovate or continuous adaptation, however you want to call it, somehow we've got to take the mind and fool it to see things in new ways. The ideas, though, are sitting there. This little graph on the right shows you where ideas really come from. Employees, business partners, and customers, consultants like ourselves to some degree, even a little bit from competitors, but to a great extent, it's not from R&D and academia, it's from the folks right around you who are also experiencing what you are. The question is, how do you tap into them? And the scary part, you're all a little like Columbus today. We have fuzzy goals. And sometimes we're a little scared to take the boat and head out of into the ocean, not quite sure how we're going to get to someplace, and not even sure if there's a place there. But innovation is really happening. And so from a trends from the trenches perspective, we've been seeing all kinds and in all ways, and we've been actually compiling a mini database about them because it's sort of interesting to see what's happening as we try to help others do the same. So the first thing is that doctors are reluctant innovators. Somehow we have to turn them into early adapters. It used to take doctors 13 years to adopt new evidence-based medicine protocols. Now it's down to about 10 years. But this visual is so indicative of what we see happening, where the older adults, the boomers who have been around, are being shown new things by younger people and adapting them. But I must tell you, I had a conversation with a doctor not too many nights ago who said to me, but I'm never sure what the evidence really is telling us. And is there good evidence or not? And that by itself sort of raised some interesting questions. This is a wonderful story about how physicians are getting engaged to help change. Summit Medical down in Tennessee, and I give you the links here, is paving the way for an accountable care organization to emerge. They're going to become a Medicare ACO. They have 218 doctors with 140 primary care physicians. But as you read their literature, they had a real challenge. How are they going to get the doctors to begin to do accountability and to benefit from what they don't spend instead of what they do, and from the outcomes of what happens? And so this is actually their picture of getting the physicians to engage in change. And what we know from the brain perspective is if we're all engaged in the process, it has far more relevance and meaning, and it actually gets into our head in better ways. I love what Cleveland Clinic is doing. I have a colleague out there who's doing a lot of work in men's health, but Cleveland Clinic is redesigning to innovate. And they are teaching doctors, nurses, and staff to think of themselves and act like an innovator. Act like an innovator, hopefully to become one, to try and come up with new and better ways of doing their jobs, and then to use the organization that Chris Colburn has created to make something from it. Innovations at Cleveland Clinic is well worth looking at because major academic medical centers all across the country are bringing them in, outsourcing their innovation, because what they're doing is taking the ideas and turning them into revenue streams. Why not? And selling it to others to make revenue from it. So there's a whole business coming out of best ideas from good places. I love this one because it's going to transform the way we get care. You can visit my website, see my Google Calendar, choose a time, tell me your symptoms. An iPhone would alert me, and I can do a house call with you even on FaceTime, and PayPal can get my paid. It's coming, not too far off. At a recent conference I was at, Walgreens was speaking about their Take Care clinics. But I found even more interesting a problem that in many hospitals is really an issue, is that they are going into the hospitals and providing the medications at the bedside for a patient before they're discharged. Now, working with hospitals, that is not a small feat because many patients take the medication prescriptions and don't fill them. So here you're walking out of the hospital with your meds. Now, what they've opened are these Take Care clinics in all of the Walgreens to provide the equivalent of easy access for you and your family when you need us. And now they're advertising bronchitis, sinus infection. We can treat these and other illnesses in our Take Care clinics. Walmart is doing it. CVS has its mini clinics. But Walgreens was talking about, and this was a healthcare conference, was how we're going to be healthcare providers just like you, or we're competing with you. But our hours are different, our staff is different, and our ability to leverage it and make it simpler and easier for people to get the care they need is coming fast. I love this story. In St. Louis, the Christian Hospital is sending EMS out to people's homes to do triage. The whole pressure on reducing readmissions in the emergency room is very powerful. Last month, Linda McCracken talked about the research that Truven Analytics is doing. About 65 to 70% of the ED visits are urgent. They can be treated elsewhere. But the people who are coming are comfortable coming. They know what the whole drill is, and they come out of habit. So EMS is changing the habit in the Christian Hospital in St. Louis. Very interesting opportunity to shift the use of your whole talent, but in a different way, a repackaging. Now, this one I love. I had a client in Michigan, and University of Michigan, one of their competitors, was putting telemedicine services in pediatrician offices up at the Thumb, up in Traverse City, at distances quite away from Ann Arbor. And what they were doing was offering clinical care specialists within 15 minutes of when a patient's in a doctor's office in their local community, saving time, determining whether there's a reason to come down and see the specialist. Telemedicine and University of Michigan are really big areas. Children's Health Fund is doing a lot of telemedicine. They have a whole grant down in Florida. They're doing psychiatric care in the Gulf area. Lots of telemedicine coming. Different types of outreach. I worked with Hurley Medical Center, and they were developing extensive high school cardiac screenings to eliminate the risk of undetected heart attacks. And first they met with lots of negative, oh, you shouldn't, and now everyone lines up out the door. Big deal. I found this one and I loved it. This is at Carl Hospital, Cape Coral Hospital in Southwest Florida. The quote here is, "We've been experimenting with daily improvement huddles," not innovation, improvement. They are 5 to 10 minute stand-up meetings twice a day to review service safety and quality performance. It provides staff-generated opportunities and ideas for improvement. That's very innovative. Baycare, if you don't know Stuart Schaefer, he's the marketing officer down there, but they're doing tremendous work in terms of population health, transforming its mission from fixing you when you're broken or sick to population health and keeping you well. This one I loved. It's out in Washington. This is a nurse practitioner who in 2008 started doing mobile medicine on her bicycle. She brings personal, adaptable form of urgent care to patients in the whole county. And it's in a little pull-along and mobile medicine. Cool. This is another form of mobile medicine, a low-cost ultrasound on a smartphone. And this is taking place often in Africa and other places where it's expensive. One of my favorites, one of my clients takes their children to the after-hours pediatric urgent care in Stamford, Connecticut, called Firefly. Pretty impressive. The pediatricians are there from 5 to 10 o'clock at night. This little sign here, Thursday, February 13th, we're open and will remain so as long as the weather permits. We've just had a foot of snow here. But these are very innovative pediatricians. You see the same pediatrician often, or one of their colleagues. But for working parents, that earache can wait till 5 o'clock and we'll get in and see the doctor and they'll take good care of us. Tremendous opportunity. My last one, coming soon to disrupt even more, is smart contact lenses from Google with chips that could read your tears and evaluate your blood sugar for diabetics. It's actually pretty close to coming out. And that way you don't have to prick yourself 4 times a day. Now, if this makes you feel like everyone else is doing it, why not you? Can you see, feel, and think in new ways? How can you actually do it? So let's talk a little bit about this. First of all, there's a continuum of innovation. All of these cases can fit on this nice grid. There's those that are doing radical change from the contact lens that might transform what you're doing, or that new way of booking an appointment and using PayPal to pay for it. Or minimal changes, changing your ED to triage, or having many competitors and being a primary care pediatric practice that open from 5 to 10. So there are lots of things here, some of high risk and high reward, but other are customer experience with cost-saving strategy. So don't think you have to do something that's going to completely dramatically change everything you're doing. Prospective client who came in with a new way of doing mammographies. It's a long way from lip to cup on that one. Now consider this. Innovation is not a lot of ideas sitting around searching for meaning. Critically important, it's tied into business strategy, customer experiences, and organizational processes, structure, and capability. It doesn't do well by itself. Execution wins. It can be incremental or market changing, and we're never quite sure for what. The cultures where there's a big innovative environment, like Centera down in Virginia, those that speak about innovation and hope it happens, these are the core values you have to really focus on. How risk tolerant are you? There are some places that reward people who take risks even if they don't work because they are truly learning experiences. Idea sourcing. Are you only talking within your silo? Crossing silos? Bringing in other partners? Collaboration. Collaboration is a big idea. How do you bring in partners or even customers to help collaborate? Small wins. We advocate small wins because they teach you more than you can imagine and they get you out of the starting gate to learn whether it works or not. A no failure attitude, very important. Are you going to have a success and failure or success and learning experiences? Could be the same things, but how you value them is culturally very different and leads to very different actions. Measure a lot to learn what works along the way. Metrics are really important. Try not to use the old ones because they may not be relevant If heads in the beds was what you measured before, are those relevant if you're going to try and keep people out of the hospital and healthy? Culture of innovation executes well on a few good wins and keeps learning is much more powerful than one that has a lot of great ideas with no way to execute. Now here's your challenge. All too often, a company has established and branded itself as a leader in its industry, but over time the company has fallen into old habits, addressing client needs with the same solutions. So we try to do more of the same but cheaper. So factory driving the business strategy isn't good. And we're moving away from competitive advantage. Rita McGrath has a wonderful new book out called The End of Competitive Advantage. It's well worth a read, because as the times change, the old strategy of benchmarking your system against your competitors is no longer useful. In industry competition, as systems consolidate around you, no longer works. So right now, it's a great time to look for new ideas and create, not compete. The other part of this is that customers, like Walgreens, customers are finding new solutions simpler and easier and faster, like fireflies, and often less costly. And at the end of the day, your staff are ill-prepared to change. I love that story of turning their ED docs and staff 3 times a day into innovators, into improvers. So let's begin. First, I urge you to define the job to be done. What do you think you want to change? To solve what problem? What job is to be done here? And for whom, really? Maybe you want to respond to the newly insured. We're getting a lot of requests to work with folks because the newly insured are still using the emergency department as their primary care. That's what they used to do. Who's waiting for them? Can you build an effective ACO or medical home? We're talking to someone else about how do you take the value of a medical home and really make it valued? Unmet needs of men. I've worked with 2 institutions, and I'm a big fan. Men die 10 years earlier than women. Only 60% of them have primary care doctors. What could you do to make men love you and come to you? The pressure to reduce readmissions and frequent users of your ED, lots of ideas coming out. Which one is best for you? Don't know. Changing demographics and lifestyles of the future users. Oh my God, the Gen Y generation is a completely different audience, and they are dealing with healthcare completely differently right now. But if you're not responding to them, the old will not work. Pick one. And it doesn't matter whether you're selling pharmaceuticals or trying to engage your PCPs. Then we're going to go through a process. And this is how we work with our clients, going through a systematic process to expand their idea bank and begin to emerge and develop new ideas. And the process is adapted from IDEO, who you may be familiar with out on the West Coast. Really a super, super place for idea creation. We start with diverging. And we start there because unless you take apart and deconstruct what you do today, you probably won't see all the opportunities resting within them. So we begin by reversing everything and destroying what you have and looking in new ways to do things. We build an idea bank so there aren't any bad ideas. What we really need to know is the research is clear. The more ideas you have, the more likely you will have good ones. You just don't know where they are. And then we begin to pull in information from across other industries and markets and go exploring. Then the ideas emerge, and we'll talk more about how you do this. It's often at the intersection in the bundle that they begin to come into something different. And then they converge into testable prototypes. Everything is a testable prototype. You include customers in the creation process. You test, and learn. And then before you know it, you have your goals. So if divergence comes first, how can you learn in this hour what to do? This is a picture of an innovation games group that is taking apart their business. And we find that innovation games are fabulous for taking apart business. I give you their website here. It's a marvelous way to deconstruct it, to reverse everything, to build a product tree and see what you can prune from it, what's really in the waste, and how to build a better product box. And when you start to build it, you begin to see how ideas can come together. As an anthropologist, I urge you to go visually exploring. You can be an amateur anthropologist. This is an old picture, but it's exactly what we do. We hang out, and people cannot tell you what they are actually doing. We've had far too many situations where we watch people and we ask them what they do, and then we watch them and they don't do it at all. So you need to go and observe, hang out. Other tools. Undercover Boss was one of my best advertising campaigns. You just watch what they do and do it as well. Hang out, see what you can see. Spend a day in the life of a customer. Have a lunch and listen. Don't ask them questions. Ask them to tell you stories about what their whole experience is like, and they will tell you everything you want to know. And take a camera. Pictures cannot be underestimated. Video. There's some who put video up and see how things are actually doing. It works. Build an idea bank. It's a place to capture and park your ideas before you know what to do with them. Create a room in your building and put up idea paper and let people come in and work on ideas. Procter & Gamble has a wonderful innovation gym. We work with a health information management company out in Chicago. We spent 4 days with an innovation gym. We developed with them to build an idea bank, and they left with a powerful new strategy to change their organization. Who and what are you looking for? A few things: non-users, unmet needs and go-arounds, pain points, emerging trends, better use of resources, better experiences. You know, it's not random. Give it a little thought. The levers that work: faster. How can you make something faster in today's world? Faster sells. Simpler. How can you make using you, choosing you simpler and easier? Often you can squeeze out costs. Think about the ED that's going to the home and doing triage instead of bringing them back. More productive. How can you make them more productive? A doctor that focuses on executive men, gives them a special space in her office while they're waiting for internet access, and make sure she's open from 5 to 8 every night and is located right near the train stop. More fun. Maybe you can make the experience less complicated, even fun. What if you were Walgreens? Where should you look? I can't urge you enough to look across industries, strategic groups, buyer groups. Look at different ways of scoping the product or service offering. If you're very functional and precise, can you make it a little emotional? If you're all about caring and compassion, can you make your ducks lined up in a row so it looks like you really got it down pat? And time. What are the new things that are coming that are going to lead you across terrain that could really take you there faster? Please don't forget your employees. This doesn't have to be as hard as you think. When we did innovation games with one healthcare client, we did almost a dozen innovation games with different employees. They had fantastic ideas. They were so excited to be engaged in the process, and they couldn't wait to tell us them, and they were big ideas. They can see what's happening in the trenches, and they can help you figure out solutions for them. Okay, so what happens next? How do you know which ideas are worth pursuing? This is a question that's asked all the time. It doesn't matter what kind of industry I'm working with. The question remains the same. How will I know? How can you reduce the risk for me? So I'll show you some ideas of how. And then how do you make sure they are effective as effective innovations? So here we are at the emerge stage. You've diverged, you've broken it apart, and now we're going to pull it together. Examine the ideas, explore, experiment, and pretend you're among the Medicis in Italy in the Renaissance. What kind of ideas would come together? How can you bundle them differently? How do they intersect? How does one thing lead to another so that all of a sudden you can see a whole new way of doing it? There was one trend, and I didn't show it to you here, but I just loved it. For CT scans for kids, they realized that they decorated the room in very emotional and warm experience, put music together. They didn't have to give the kids medication to relax them. And so they could move kids in and out of CAT scans faster. The kids were happier, and the time it took was reduced, and the results were excellent. What can you do to explore and experiment? If you're searching for small wins, how do you begin to develop testable new solutions? I urge you on the small win track. Because when you start to do small wins, you're starting to tell small stories about how it's actually working. And that leads to more trust that, in fact, you can do it. And incremental is better than none. Now, maybe sometimes there's a big idea, but for the moment, all the cases I showed you were some small, some bigger, but nothing that is going to blow the place up. Remember this continuum of innovation? I don't need to go over it again, but it's a very good way to think about where you fit. Now, when you begin to pull the ideas together, you're going to have to watch for them at intersections. Get the team up there. Move stuff around. Post-its are my friends. They should be yours. See what kind of pictures they could draw. I love the innovation game about building a product tree. Because what is the fruit? I can't tell you how many times they don't know what the fruit is. So how do we know what the roots are? And if we don't know what the roots are, then how are we going to build a trunk to support it? It's fascinating. And then sometimes things have already been harvested, but we haven't taken them off the tree. So you can try that. It works well. There are several models we use. I thought of bringing just one, but in fact, we're very sensitive to how to apply a theory and tools about that theory to different processes for different clients. So we're working with one client now where business model generation, this marvelous approach that Alex Osterwilder built. He had 470 co-creators. It's a great process, but the business model canvas is a wonderful tool to lay out what you're doing now, and then how you're going to move the elements around and add new ones or other ones, and it's a great tool. I'm a blue ocean strategist. I can only tell you that it is a marvelous, marvelous book, but the processes are fantastic. And both Renee Morbon and Chan Kim have a huge program at the INSEAD in France, and they've been given a bunch of awards as thought leaders. Their strategic canvas helps clients see what they have now, how it competes, and what you could eliminate or reduce, raise and create to open a whole new value, innovative creation. What we're looking for is how to create demand and open new market space in innovative ways. I think of this so often for the newly insured, because we newly insure them, but we don't change their habits. So how can we create demand for them that can show them a better way of getting care? The third is Rita McGrath and Ian McMillan's book, Discovery-Driven Growth. They have several. Rita, I mentioned, has a new book out, The End of Competitive Advantage. It's a very good approach. I'll show you some of the other elements of it. But any one of these can give you a point of departure for how are you going to start your process. They all share the same starting point. You need clarity of a new job to be done. Are you going to turn the undesirable to the most desirable? Maybe bundle pricing is ready now. How could you do it? We actually had a client who had an online market space, a little like Expedia, to provide bundle pricing for hospitals. It was too soon, but it's coming. How do you open new market space addressing unmet needs? What about men? How do you find non-users and new users? How about those newly insured? Each of those concepts, approaches, methodologies lead to asking, what's your strategy? Strategy is a clear, simple story. The way the brain works is that it takes all the facts, it sorts them based on your perception map, and it builds a story, and then it keeps telling the same one. So you're going to change your story, and that means you're going to have to take the ideas and reformat them. What's that new strategic vision? What is it you're trying to do? You need to be clear at the beginning or the ideas will wander around. Visualization, even among fuzzy goals, is extremely important. So create a visual story about what this whole thing is going to become, and then backward plan it. Now, I know this sounds bizarre. Most people do their plan for the next year today, and you plan out a month ahead. Go backwards. A year from now, in July, as this little graph shows, we're going to have achieved something dramatic. We're going to reduce readmission in our ED by X amount. And if that's the case, what will we have done in June? What will we have done in May? How about in April and March, which is coming up? Because if we backward plan it, we can realize whether or not it's possible or not. Several times I've done this, and the aspirations were far bigger than the opportunity to actually achieve it, and so we had to do a backward plan all over again. I will only tell you the brain loves it. It's clean. This is a similar game called Remember the Future in our Innovation Games Toolkit. Remember the Future works extremely well. It's very much the same, but it's full of feeling. How does it feel when you got there, and what is it like when you made it? Now, convergence. Okay, we begin to see the intersections. We're beginning to pull together and see this in new ways. We've built a better product box. We've pruned the product tree. Now we're coming up with testable prototypes. We're going to include customers in creating process here. We're going to test, and learn, and then we're going to begin to take some action. It's a perfectly good time to engage your partners. When we worked with our health information management client, they were trying to resolve problems for their hospital clients at the same time that their hospital clients were trying to resolve their own problems around all of the ICD-10 coding, the way in which health information was going to be recorded differently. And so rather than do it alone, what came out of our innovation game week together was a whole lot of partnering opportunities. Why are we doing it alone? Why couldn't we help each other in the process? Often we find the same thing with physicians. There was a group in St. Louis that partnered with home care. as a way of keeping patients out of the hospital. And they were doing extremely well on a CMS test case, making a lot of money by having patients cared for in their home. Customers. Build a prototype and let them come in and tear it apart. Do a rough draft and let them edit it for you. How can they intermediate it for you? The image is fantastic. Let them peel all of it back and figure out what's going to work or not. My only urging for you is that they too don't necessarily know what they don't know. And so use it wisely. You don't have to listen to them and do like Walmart's did and change its whole market to look more like Target's. That wasn't what was going to happen. You have to be careful that you don't overuse it, but it's extremely helpful to get them included. Now, how about culture? Ongoing innovative cultures. Innovation is both a process and a culture. 4 of the most damaging words an employee can say to you is, "Oh, forget about it." I love that ED doctor who had them engaged in improving. I love the ACO in Tennessee trying to engage the doctors in the process, changing the culture. So change can lead to a culture where we never rest on what we have always done. That old habit has got to stop, but we search for new learnings and constant choices. That changes the focus of employees, and they start to see things in new ways as you do. Important for this is to change the story. Storytelling is extremely powerful. The brain loves the stories, as I've mentioned, to organize the facts. So innovation is all about changing the story and telling it a lot. Don't tell it to yourself. Get out there and tell the story. Use social media to tell the story. Use others to help you in the process. Visualization is critically key here. The brain has to see it to believe it, really. And the oldest part of the brain, the reptilian part, is where you decide, it's where you see, it's how it feels, and then you logically prove it. Try to create an amazing abundance of ideas in a space where people can express the relationships between concepts, features, or other priorities, and manipulate the objects in a visual field. Now, this image is painful because this is what innovation is like. It's like either a bucket or a funnel with valuable leaks. It's not already what we know. It's not the habits that we've got. It's not what is today. It's all the stuff pouring out of it that can help you set goals and really get you to see things in new ways. Leadership engagement. Now I left this for the end, but it's actually the beginning, and I repeat it often as we're working with folks. If the leadership doesn't have a clear focus and aren't buying into the vision and strategies, it's not going to happen. Senior leadership needs to change its own thinking. I actually worked with an executive, and after 90 days he had changed nothing. And that's when we had a conversation about whether he was going to lead the change or wait for it to happen and hope it was okay. Very, very important. Their voice and their stories have to be critically involved in the whole thing. And it's not a sub-community that you set aside. It's not an innovation group that you put aside. It's not something where you can separate it. Remember, Procter & Gamble has all of its employees, particularly its brand managers, involved in doing 2 things: bringing at least half the ideas in from outside and becoming advocates for the innovation. They also have them hang out, and they do a lot of anthropology. They teach their brand managers to see, feel, and think in new ways. This is a graph that pulls it together very nicely from the Rita McGrathy and Macmillan book on discovery-driven growth. So I pulled part of it out. It's a little bit longer, but this works for us. In a conventional corporate culture, success is defined as making your numbers. How many heads in the beds? What's your census for the day? What's your book of business? You hit your projections. In a discovery-driven culture that's coming, your innovative one, this is about learning as much as you can for the least possible cost. And I say that because in blue ocean thinking, we often talk about the pattern is for people to add value and add cost. But in fact, the whole innovative process is about adding value and dropping cost. Get rid of stuff that doesn't add any value. What are you using and doing that doesn't add anything? Don't just keep Susie because she does that report that nobody reads. Give it good thought in terms of how can you strip out the cost to do it faster and easier. Management focus. In conventional corporate culture is the day-to-day operations. In a discovery-driven culture, a little like that ED or the ACO, or even in Baycare, it's all about innovation, top of the agenda, top of mind. It's part of your huddles. It's part of your overall business approach. Timing. Conventional corporate is dictated by budget or planning cycles. In a discovery-driven culture, if you've really done a good backward plan, it's dictated by key learning checkpoints. Different mindset. Revision. In a corporate culture, it says it's a mistake. In a discovery-driven culture, you don't have mistakes, you have learnings. It's a very different value and a belief system. The funding in a conventional corporate culture is allocated all at once or not linked to milestones. In a discovery-driven one, you limit the amount that you need to achieve the next milestone. Really different risk-reward. People said, how do you minimize the risk? Well, you don't push it all out at once. You build it as your small wins test and teach you what's important. Determination. When do you stop something? Well, at Procter & Gamble, if you're not seeing the ROI that you projected and is your standard, you get an award for closing down something and taking it apart, repurposing everything and learning from it. In a conventional corporate culture, you find that you delay terminations. And that's not about people, it's about programs or projects. Things are avoided or reluctantly pursued. You have a process here. We're not making any money on it. When are we going to stop doing it? Oh, we can't. It's all part of what we have to do. I was working with a physical therapy group that was part of a hospital system, and they weren't getting referrals from doctors, and so they were dependent on inside the box, and it was never going to turn into anything. When was it the right day to close it and just simply refer out? Discovery-driven culture occurs as part of the planning process. It's a disciplined disengagement. You begin with the end in mind. So let me begin with my end in mind. There are 5 steps that I would like you to leave with today. The first is the goal. You have to begin with what you think you want to achieve. Make them fuzzy. Make them big. Try to visualize it. How will it look and feel? Use games to help you. You don't need to use facts. Use images. Take a lot of pictures and put them together so that you can begin to visualize it. Then tell a story about it. Diverging. Take apart everything that's being done today, whether you're doing it or others. It's very important that you deconstruct what's already in place. Go visually exploring, hang out, see how people are doing it. Use games as a way. Serious play to do serious work works. Hanging out, I start every engagement with a client by hanging out in their lobby, on their shop floor, in a surgery suite. I watch. What are we looking for? I worked with one who was trying to eliminate harm, and we saw lots of harm happening. It was really interesting. And do it in different places. Get out of your normal area, go to different industries, different market segments. Build an abundance of ideas. The more you have, the more likely you will have great ones. Next, see what emerges. Let the ideas come together. Watch the intersections. Engage lots of people, employees, partners, customers, and patients, and see what you can do. Converge them. Create a testable prototype, a model that's visualized. Test some more. Learn from each test. And then launch and test and remain open to pivot and redirect if necessary. We met with a startup the other day, and he said, I went this way, and I realized I wasn't getting any traction, so I pivoted and redirected, and I'm going this way, and I'm getting great traction. I'm going to the end users, and I'm not going to the middlemen, and the end users see it, and they're buying it. Oh my gosh, it was so exciting. Metrics matter. I haven't spoken a lot about metrics. For today, I didn't want to because this is all about finding the right metrics to know if your prototypes, models, trials, and tests are working, or you might as well not start at all. But don't use the old metrics without questioning whether they're the right ones, and begin to see what it is you're trying to really achieve as the goal develops here. Now, I love this little metaphor. Remember I talked to you about how the neo-Darwinists are changing their thinking? That you need a lot of mutation for natural selection to take place. Well, this is a metaphor of that. Innovation comes from the inside out. I know you need a crisis, but it has to come from inside your organization and a whole lot of folks that can help. If an egg is broken by the outside force, life ends. But if broken by inside force, life begins. Great things always begin from inside. It's just a great image to hold on to and keep pushing along, because quite frankly, the changes are there. They're for you to help move forward, but they're not going to come unless there's lots of ideas coming from inside the box as well as outside. Now I'm going to take questions in 1 second, and I've had a number of them arrive. And I would like to first, though, just simply promote my next webinar. We've got a series, and we are probably going to do it right through 2014 because we've got such good response and a wonderful follow-up from it. But on March 14th, next month, Margaret Davino, who's a marvelous attorney and partner in Kaufman, Burgast, and Ryan, and the chair-elect for the New York State Bar Association Health and Law Section, is going to be speaking about all of this from a legal and regulatory perspective. And she's very in tune to how hospitals, physicians, and other providers are changing and what this all means, particularly accountable care organizations. She's a marvelous speaker and a longtime colleague. I want to thank our sponsors, Health Information by Design and Sound Basta. It's a marvelous organization on LinkedIn. If you haven't joined it, please do. They have over 6,800 members, and they are a terrific group of people to share ideas with and get more ideas. And now some questions. One question is, I want the company I work for to innovate and go in new directions, but my stick-in-the-mud managers don't share my vision. How can we get them to change? This is an extremely important question and not necessarily easy to answer in the minute we have, but I will tell you that until people see it and feel it themselves, they discount it. Remember, they're herd animals and they are very comfortable with the habits you've got. I could say have a crisis, have an expert session. I've done this very well, where you bring in experts from around different industries to help them see what's coming. And then you have to have senior leadership who are recognizing that this is a problem and begin to work with them on it. I will tell you that a week away at maybe a Center for Creative Leadership is a great organization that can help. And often it's a great way to begin to get them to learn how to do this. When I did that innovation gym for that health information management company, they didn't realize how to do it. So people say, I'm all for it, I don't know how, and that's not helping. Now, I've got another one. How can I tell if a new idea is worth the risk, or is it just a fad? The time frame, there's a great article in the Harvard Business Review last March, and it had a great chart in there. The speed of change is so fast that you're going to have to simply embrace the risk associated with it. But the old way of doing things was that it came out, I always think of the Kodak Brownie camera that came out in 1907 and didn't disappear until 1970, and now Kodak's gone. But the time frame has changed, so things that used to be fads are now the norm. It emerges, it surges, and it purges. So you should be less concerned about the fad than the testing and the learning and what you can take from there. So nothing should be thought of as the way we're going to do things. The way we're going to do things is all about testing and learning. Now, this last one that I'm going to have time for is I've asked my staff to submit ideas, but they're not responding. I will tell you the fear of failure is keen. And so the thing that I should urge you to do is try to build huddles, innovation games, lunch and learns, and begin to take for each of them an idea and turn it into a result that is a small win. When I did this with one healthcare client, we started to build a small win solution. And every week we would see an idea and we would get out there and try and actually do it. If they are rewarded for great ideas, you will see them doing some great things. If not, I can only tell you that they are going to go backwards. And so part of this is how you lead them in new directions. I will only tell you that I truly enjoyed sharing this time with you. I truly appreciate all of you who spend an hour of your lunch with us. I wish I could send you pizza and a beer, but it doesn't work. But I thank you for coming out. And please, I have my information here. This turns into a video that we put on SlideShare. We've had great results on SlideShare, so share it. And if it can be of help, I'd be delighted to take it further. Thank you so much. And I'm going to sign off now. Thank you again.